Assalamu alaikum. Bismillah ar-Rahman ar-Rahim. Salatu wassalam ala Rasulillah. Good morning, everyone. I'm really happy and delighted to be with everyone here today and to kick off our third Society of Simulation Scientific Assembly of 2021. I'm honored to start our talk today, and first of all, I would like to thank the organizing committee and the scientific committee for all their amazing work and preparation for this assembly. So to start off, during the last couple of years, these symbols have become something that everyone became familiarized themselves with. It became some of our norm, daily life, to see these symbols and to act according to them. COVID-19 had a great impact worldwide. It impacted everyone around the globe, and everyone on a personal level as well, I'm sure, had their own experiences during the pandemic. However, focusing on how the healthcare providers and what they went through during this pandemic will be some of the focus of my talk today. I will be going back to the beginnings when it started and where there was actual need to prepare the workforce, especially the frontliners, to be able to fight this pandemic and be ready to accept a surge of patients within the hospitals and healthcare facilities. So today I will be talking about upskilling healthcare providers during the pandemic through education and simulation. There was a national movement within the kingdom, knowing that as the pandemic hit in the beginning of early 2020, there was definitely a need to prepare all healthcare providers and upskill certain people, personnel, to be able to fight the pandemic. So my talk today will be covering three aspects. First of all, I'll be talking about the educational response for the workforce upskilling, and then we'll be shedding more focus on our local experience in training and how we did this training for the upskilling of healthcare providers. And finally, I will touch on how we utilize simulation within this program. I would like to acknowledge first that the work that I will be talking about today, actually there was a huge team responsible and behind it. And I'm very honored to be the person to share this information with everyone. I know a lot of the people who are with me, involved in designing these programs are with us today, and I just want to make sure to acknowledge everyone's work within the kingdom for this huge project. So first of all, talking about the educational response. So because of the beginning of the pandemic, there were a lot of information and knowledge that needed to be every healthcare provider aware about. And from that, to upskill all the healthcare providers, we felt that they needed some educational training to prepare them to work within the front lines. So a knowledge and skills gap or areas to enforce within their knowledge were identified. And it's kind of mainly focused in 4 aspects, which is the personal protective equipment, infectious disease, knowing more about the illness itself and disease, the pandemic that is spreading, knowing how to deal with it within emergency and critical situations, dealing with critically ill patients, and dealing with a crisis and disaster. As they're knowing there will be a huge surge capacity of patients coming to the hospitals, and we want to make sure that everyone is prepared to deal with that. Thinking about the targeted audience and who will be involved within this training, it was identified that we might have non-healthcare providers that will be volunteering and helping. There might be healthcare providers that they are not specialized with either critical care, emergency care, infectious diseases, or even respiratory disease. So there was a need to identify their specific needs, and there were also specialized healthcare providers where the areas that they needed to be enhanced within their knowledge to prepare them and upskill the workforce to face this pandemic. Thinking a bit about it in a bigger way, the team decided to make sure we focus on the knowledge, skills, and attitude, and making sure that we go focus we approach this in a focused way to make sure we cover all the aspects. knowledge about, which is the basic information that is needed. There are also skills, clinical skills that are needed to work within the front lines. However, attitude was also very important, dealing with in crisis with teams and communicating in that difficult time and situation that was there. That said, amongst the discussions the team had, and when we were designing this, we also identified that there was an important aspect we definitely did not want to neglect, which was the wellness of all the healthcare providers. And that was identified that how important it was to make sure that every healthcare provider, it's very important to take care of their own wellness, physical and mental, and how that contributes to the well-being of the workplace. Wanted to make sure everyone is able to support each other during these difficult times. A basic educational approach was utilized. Current 6-step of curriculum design was development. Were also the methodology that was used to make sure that we focus on each area and aspects for this national program to be done, and making sure that we cover each aspect in designing it. So we a little bit talked about the problem identifications and the educational needs assessment. There was very specific, clear, targeted goals and learnings. But when it came to the educational strategies, and here we wanted to think about more innovative because it was some lockdown situation during that time. So what was the best methodologies that you can utilize in delivering this education? So it was decided that it will be an online asynchronous self-paced, so everyone can log in on online educational content and finish it on their own time, knowing that a lot of healthcare providers were actually working and they might have not had enough time to leave or go attend anything, specific lectures. So it was designed as an interactive, that there was more interactive aspect of this online course rather than making it a one-way. There were videos, animations, recorded lectures, and we want to make sure there is some assessment and knowledge checkpoints within it and some webinars. However, we did talk that we wanted to make sure there are also some practical skills training. So for that, an educational methodology of a flipped classroom was adapted, utilizing some videos to people to prepare them to look and understand more specific skills. And then simulations were implemented, and I will talk about it later in my talk today, along with a competency checklist to make sure that everyone achieves what is expected from them to become competent from certain skills. So that was the general approach that we had in thinking about this from an educational perspective. So more in details about our local experience and what we did for this training. Actually, 3 programs were designed and launched. The first one was the medical volunteer training program, and that was aimed for non-healthcare providers who wanted to volunteer and work within some facilities. I will be not focusing on that today. I'll be focusing more on the other 2 programs, which were the COVID-19 critical care crash course, the essentials for non-critical care physicians, and the COVID-19 critical care advanced course, which was designed for specialized people who work within the critical care. About our COVID-19 critical care crash course, or what we called the 5C program, its aim was to provide basic knowledge and skills to successfully manage critically ill patients who are suspected or confirmed to have COVID-19 infection, specifically in the critical care settings. The targeted audience who were physicians who did not receive prior formal critical care training, and it was part of the national preparedness plan within the kingdom. The impact of this program was expected to increase the patient-physician ratio, hence increasing the healthcare institution capacity to manage increasing numbers of critical ill patients who are expected to come during that time within the pandemic. So the program was comprised of 2 major components. There was the online part that I talked about and the practical hands-on training. Everyone needed to complete the online part successfully in order to proceed to the practical hands-on training. We kind of divided it to 3 major milestones. The milestone initial was in online self-directed learning that needs to be finished. Then they moved to the webinars and online lectures, and then they moved to the practical simulation. A little bit more information about the online material that was provided. There were like 4 lessons that covered critical care elements, basic airway management, and general infection prevention and management of infectious disease. And that were the most basic information that were needed for anyone who worked within the area. The virtual didactics or lectures, there were 4 focused lectures on, first one was on infection prevention and control measures. The second was the essentials of critical intensive care for non-intensivists. And then we started to make sure that we focus on the non-technical skills, including the risk communication and interprofessional practice and working within teams, especially in critical times and critical situations. And the most important lecture that we really believed we wanted the investment was in taking care of you and making sure of the physician and healthcare provider wellness and how they can cope within this situation of the pandemic and the overwhelming number of sick patients. So that was the first course. The second was the COVID-19 Critical Care Advanced course. And in this advanced course, the aim was to provide practical approaches on managing critically ill patients who had suspected or confirmed COVID-19. And when we designed this course, it was actually after there were a lot of updates and guidelines that were published on a regular basis, almost on a daily basis, that were either shared through the WHO or locally within the Ministry of Health. And it was a lot of overwhelming updates and information. And we wanted to collect that all in one place for people who work within the critical care area, so could they go and get updated and get all the knowledge that it needed from one place. So the target were physicians who work within the critical care areas, and the impact that we wanted from this program was to increase the awareness of the current guidelines and updates on COVID-19 critical care management. And also we wanted to focus again on ways to stay safe and well during the work in critical care areas. This course it was an online course as well. It included 2 interactive case simulations for all the participants to be engaged in, and they actually had to manage some sick patients who were suspected to have COVID-19. And there were online 2 learning modules that was COVID-19 ICU management and also staying safe during COVID-19. So this is just a screenshot of what was on the online course that talked about their simulation, the videos that they needed. We made sure there was a related resource like library area on the website so everyone can just log in every time, and we make sure we updated that on a regular basis with the latest guidelines that were published. Again, there were 4 modules, 2 simulations, which was, you can see here, it was Ali and Dalal. There were our 2 computer-based simulations, and that ICU management and staying safe. So those were the 2 courses that were done locally and were available for all the healthcare providers to take for free, and it was available for everyone. So we'll move forward towards the simulation utilization how is simulation used within these 2 programs to upskill the workforce during the pandemic. So there were actually 3 major methodologies that were used to integrate simulation through this educational training. First of all, videos, but these videos were utilizing simulation and how to make sure that everyone stays safe. These videos were done in simulation centers, and we thank everyone who was helped and volunteered in directing and getting these videos done. The second was computer-based simulation, and the third were actually using the simulation, which were task trainers and high-fidelity simulation, and that was the most challenging part. So just quickly going through the videos. So the way the education was designed, we wanted everyone to watch these videos that utilize simulation on basic skills, either clinical skills utilizing task trainers. So those were phase 1 of that. They need to watch all the videos that include procedural skills training. The phase 2 included videos on non-technical training, which is simulation cases, and mostly focused on crisis resource management and how to deal with crisis within a team and in an emergency situation. So a full video utilizing a simulation scenario was designed and developed with correct actions and how to improve it during the training. After that, they were allowed to go to do the practical trainings. So these are just screenshots on the online learning platform with the videos. And you can see that there were some skill videos and specific courses on utilizing some how to do procedures or utilizing certain equipment and machines. And the fourth video was basically a video on a simulation scenario on crisis resource management. After each video, there was a small assessment quiz, making sure that the major takeaway home messages were actually provided, and the learners and participants got the appropriate knowledge and information that are needed. So I'll talk a little bit about the computer-based simulation that was designed, and we're happy that we were able to collaborate with a specialized team in designing these computer-based simulation in a gamification methodology of education as well. And actually within also the computer-based simulation, a lot of rules were we made sure that they were provided, and instructions on how to play the simulation online, and wanted to make sure everyone got engaged and dealt with these scenarios as real patients as they went through each step during those computer-based simulation scenarios. They had a lot of questions that they had to enter, and they got different answers, and it was mostly a little bit adaptive. So depending on your answer, the patient either deteriorates or responds. So this is our first patient, which was Ali, who was presented to the emergency department with unstable, very sick. And as you can see, there are monitors, and as we proceed within the scenario, they get different information. Our second case was about Dalal, who had deteriorated within the ward and needed to be shifted to the critical care area. And it was a lot of interactive and want to make sure that it also had the local aspect and culture-wise and the system that we work in within the kingdom. So last but not least, and this is the most difficult part, is actually doing some practical training utilizing task trainers. And this was done all over the kingdom and a lot of cities within the kingdom. And it needed a thorough planning and collaboration with everyone. And it was amazing experience, as everyone within each city made sure that they participated and were very keen on making sure the workforce within those cities were ready and trained within certain aspects. So to enable the team to do that, there were a lot of meetings done. And in each meeting, we sat down with the team, explaining with them there was an introductory meeting, understanding the overall program, the expectation, what needs to be done. The other meeting was the implementation plan, how it's expected to them, what they need to prepare. And the third meeting were with the specialized trainers who were actually going to conduct the sessions. And we provided everyone with checklists and information to make sure that they are able to provide the practical training as expected. This just shows us a flow chart on how it was done. We did an introductory meeting, and it was all online, by the way, just to make sure during that time it was a lockdown, and there were a lot of social distances and restrictions. So it was all virtual meetings done, and everyone collaborated on that. The formation of in each region and city of a group that was responsible of this training. A follow-up meetings were done until the launching of the practical component. We made sure that there was a good support for each area, and if there's any challenges that rise, we see immediately how can we help in providing that. So in the next couple of slides, I'll be sharing some pictures from each region that participated in that. We had a lot of pictures, so this is just selective. I was not able to put it all during to the time, but I do not own these pictures of myself. I'd like to thank everyone who shared this, and a lot of them, I'm sure they are here with us today. And they're very, very proud of how everyone was able to conduct these sessions, complying to the restrictions and social distancing as well, and making sure that everyone got appropriate training through that. So these are some pictures from Jazan region, and Medina al-Munawwara, Jeddah, Mecca Mukarrama, from Tabuk, Al-Gurayat, from Al-Ahsa. A lot of pictures from the eastern region as well. Hafr al-Batin. We have Najran, the northern borders. الطايب, also from Al-Qunfuda, Qasim region, Hayil, and last but not least, Al-Baha. And these are just selected pictures. And it was very amazing how everyone's response and their contribution and collaboration in making this training happen and complying to the restrictions as well. These two program training were able to be done over 20 cities within the kingdom. Over 4,000 healthcare providers were trained for the 5C program, and over 3,000 were able to participate within the advanced course as well. The target was actually achieved over 161% of the expected training physicians to upskill these healthcare providers and prepare them to face this pandemic. I'm very proud to be part of this team, and again, it was an amazing collaboration with a lot of experts all within the kingdom who were able to design this and prepare this and upskill all the workforce and prepare them utilizing education and simulation. It is said the future depends on what we do in the present, and during that time, I believe this was one of the amazing responses towards the pandemic, utilizing education and simulation, and that helped a lot to where we are here today within being able to have less restrictions, even though there are some talks of some new variants appearing, but making sure that we have a lot of lessons learned and how to utilize that information and making sure we build on it. And we're being very proud to be able to respond in this way and utilizing education and simulation, and how important it is to be part of the planning within disasters, pandemics, and crisis situations. Thank you all for your time. If you have any questions, I'll be more happy to respond.